Today on Keynote.
I think the way we deliver care is going to look very different even in 2 years, let alone 5 years. The technology is coming fast and furious, and I personally believe that we need to own, we meaning nursing and frontline clinicians need to own what that integration looks like.
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump into the episode. Today, I'm thrilled to welcome Dr. Theresa, also known as Terry McDonnell, Chief Nursing Executive and Senior Vice President at Duke University Health System. Terry is a nationally recognized force in healthcare transformation, named one of modern healthcare's 50 most influential clinical executives and featured in Health Tech magazine for her leadership in workforce reinvention. With a rare blend of frontline nursing experience and billions of dollars in executive oversight, her work is reshaping how we care, how we lead, and how we innovate. Thank you for joining us today, Terry, and welcome to the show.
Thank you so much, Sarah. It's a pleasure to be here.
And you've been described as someone who bridges the bedside and the boardroom. And I'm curious how your clinical background shaped your executive leadership style.
So one of the things that I find very important, even in my administrative role, is to maintain a clinical practice. So I am also still a practicing nurse practitioner. GI oncology is my clinical subspecialty, and I've been doing that for 20 plus years. So I know the challenges of seeing patients in a clinic. I know the challenges of, when things don't go quite right. And that, I believe, helps me bridge that gap between what happens on the front line and then the decisions that we need to make at the highest levels of the organization. Obviously, I don't have the full vista, but keeping the patient experience as the North Star and having those conversations and then pulling people in from the front line with different perspectives helps inform those conversations leading to the boardroom.
What's interesting about you still having, honestly, feet in all different camps of what you do and how much that's appreciated, I think, by those that you serve, but those with also whom in some cases you have to influence and convince. What would you say are some of those core leadership principles that guide your approach in overseeing large, diverse clinical workforces?
I would say first and foremost, it's empathy. You have to have professional empathy. You have to be able to walk in the other person's shoes and understand their pain points, their anxiety, the thing that's driving them. Also, compassion is key, especially these days, but hopeful transformation. Those are the components that I feel I rely on heavily in my leadership because you've got to pull people together that are coming at things from very different perspectives with different opinions, different priorities. But at the end of the day, the North Star always has to be the patient and the patient experience.
I often will have that conversation with people, Terry, and I say, we are all patients. And are you leading from that perspective when you're making decisions in healthcare and technology? And you really lean in on innovation heavily for so many of the reasons that are so important to those that are performing the care being given to patients. And you've made major strides in nurse retention, cutting turnover from 21% to 11%. What are some of the specific changes that made the biggest impact?
Again, engagement, listening, understanding the pain points. And we've done a lot of work in empowerment. So when the front line feels like they're valued, their opinion matters, when they're engaged, when we ask them what the pebbles are in their shoes, but then we ask them what they see as the path forward and the solution, that helps create that culture of empowerment. And it's that culture of empowerment that then drives the retention. When people feel like they're just a cog in a wheel, they don't feel any sense of belonging. And one of the things I'm most proud of in the last 12 months here at Duke is we actually just had another Culture Pulse survey where we, send a survey out to our staff, and our belonging scores were some of the highest we've ever seen. And we benchmarked far higher than some of our sister organizations. That brings me joy to know that people feel like they belong here.
Well, and you talk about pebbles and shoes. What I love about what you just shared, and congratulations on your scores being higher, especially that's hard, very hard to do. is when you're asking people what's wrong and they tell you you're doing something about it. And you're also having them be part of that solutioning. And too often, when we think about how challenging it is to truly achieve organizational change management at a level that is successful, it's because we don't involve people early enough. And then if we do ask them, we almost ignore what they tell us. And I got to believe that's partly what led for you to appoint Duke's first ever Chief Nursing Innovation Officer. How has the role evolved and how has it played really a pivotal impact on what you're achieving there at Duke?
Well, so it was interesting how we got to appoint Dr. So our Chief Nurse Innovation Officer is Dr. Ryan Shaw. He is a PhD prepared nurse scientist. He's an educator. He's an innovator. He has a dual appointment with the School of Nursing, the Duke University School of Nursing, and the health system. And the way it all came about is as we were trying to really cultivate this culture of nurse-led innovation, Ryan was the natural leader in that because Ryan has done a lot of work on the School of Nursing side, working with nurses who had conceptual solutions to problems. So I'll use one prime example. There was a nurse who worked in the pediatric ICU who was finding it very difficult for little squirmers, those little kids in beds with all the tubes and the lines and everything, making sure that those lines were safe. So she went home and she was somebody who liked to sew, and she crafted this Velcro enclosed tube called the line snuggler. And Ryan worked with this nurse to refine it, get something then that could be FDA approved and mass produced by bringing her idea, the School of Engineering, the School of Nursing, and industry together. And how wonderful if we can give our nurses and our frontline staff the ability to take their concepts from that early workaround, because we all know nurses are the great experts of the workaround. We solve problems in the moment with what we've got. But then to take some of those concepts and bring them all the way through so that they are actually something that can be manufactured and shared and disseminated broadly, not just in our hospital or our health system, but around the world. And that is one of the primary goals of Ryan's role. But also, as we're introducing new technology, new innovation, how do we measure? How do we evaluate? How do we pivot? His role is also integral in that as well.
Well, and I was reading about that invention. I literally was thinking, what a perfect name for the environment and it's being used in. Like, you didn't make it like a name that has a pref card on it. It's like the line snuggler. I'd like, at first I was like, oh my gosh, if this is like getting in line to hold the kids or hold the babies, sign me up. And I'd find out it's for tubing. And yet, what a great way to impart the empathy that you mentioned earlier on things that you're doing in your healthcare system just by the things that you're developing. And your nursing innovation hackathons have engaged over 10,000 frontline staff. How do you foster that grassroots innovation at scale like that?
It's a number of different levers that we pull in order to get that culture of innovation. So we put a call out, and we've done a few of these now for the hackathons. And we ask all of our nurses, so again, about 10,000 nurses, give or take, what their ideas are, what problems they're seeking to solve. And then they come together in teams. And usually what we have on the day of is around 25 teams that will have a specific idea, and we'll bring them through in a half-day workshop through refinement of the idea, giving the pitch, and then we give the awards. And we understand then from that work who we're going to move forward. But the other piece of this puzzle that continues that engagement and kind of that chronic innovation is we launched an initiative during Nurses Week this year called Empowerment Through Innovations. So we've got clings up everywhere. We've got a SharePoint site. We included in our weekly newsletter. There's a QR code where anyone can scan the QR code, and it brings them to a series of 4 questions. What's the problem? What have you tried? What do you see as being the solution? And what resources do you need? And we then vet those ideas, and we're kind of bucketing them in t-shirt size. There's a small, medium, and large. The large we're going to end up doing crowdsourcing to prioritize kind of the big things so that we can bake them into the budget. But then the small ones and the medium ones, we've been just taking ideas as they've been coming in and addressing them. I'll give you an example. We had one nurse in interventional radiology who was bringing forward the issue around patient falls. You get the patient there, you get them up on the table, but then they've got to go to the bathroom and they don't want to use a urinal or a bedpan when they're up on an interventional radiology table. So what they wanted was walkers. Very simple, very inexpensive. So we bought them a bunch of walkers and we delivered them. Those are the types of things where in isolation, it doesn't seem like a big deal, but when you're that group of nurses that are frustrated and perseverating on the issue, the problem, the thing that they can't fix for the patient, and you bring them a solution, that then unlocks something in the staff. So then they start thinking bigger and they start thinking of different ideas and different solutions.
You're making it easy for them, a QR code, and anybody at any point, they can just type in the information they're thinking, and it doesn't go into an abyss. You're actually going to do something with the information. So that alone is going to get people wanting to do more and more because you're seeing them in their ideas. But it all comes from like strategic transformation, which is another one of your hallmarks. And when you were at Fred Hutch, you were part of a team that led one of the most complex mergers in healthcare history, $1.7 billion clinical integration. I would love to hear more about that.
Those were some fun times. So the Seattle Cancer Care Alliance was the clinical care delivery arm. It was an organization that was created by 3 member owners, Seattle Children's, UW Medicine, and the Fred Hutchinson Cancer Research Center. It launched in, I want to say 2000, and it was wildly successful. And we took great care of probably hundreds of thousands of patients. But the foundational issues remained the same throughout the continuum of the existence of the SCCA. Brand recognition, operational inefficiencies because of the way it was constructed, and a little bit of a disconnect from the natural synergistic relationship with research. So the man who really led the charge and made it all happen together with the leaders of the member owner organizations was Tom Lynch, who is the director of the Fred Hutch Cancer Center. He brought us all together and there was a commitment to restructure after 2 decades of really trying to think this through. So the baby that was birthed was the Fred Hutchinson Cancer Center. So we had to bring together, 2 separate operations, sharing missions around cures of patients with cancer, but one deeply rooted in patient care and the other deeply rooted in the science, and bringing those cultures together, bringing the P&L together. It was quite a wonderful journey, lots of learning, lots of mistakes made along the way, but the organization that is now thriving is very impressive, and I'm proud to have been part of that. But it was a lot of shuttle diplomacy, a lot of reassuring people, because when you're doing that kind of work, reassuring people that it's all going to be okay at the other side, that's really important.
Terry, you didn't stop there. You went then and secured $710 million in philanthropic investment, which is also a huge win. How did you align the vision with that fundraising effort to create such an impact in that community?
It was the Bezos Family Foundation that ultimately underwrote that donation, and they had a vision that they really thought it important that clinical care and scientific discovery be together and integrated. And again, it was because of all of that work that we did that we were able to work with the Family Foundation to then realize that gift. And again, I think because of that gift, the Fred Hutch is continuing to innovate at very difficult times in that space. And I'm hopeful that we will continue to see cures and discovery out of the Fred Hutch because of that work.
They are very much part of our ecosystem, UW and Seattle Children's and Fred Hutch, just from the presence we have with Seattle City Tour dinners. And one of our principals used to be at Seattle Children's, but all those organizations are in the mix of This Week Health. And so we get to hear about all the amazing things. And thank you for laying so much of that groundwork. When it comes to technology and policy, they aren't standalone either. And you've advocated for integrating AI to enhance human care, not to replace it. Key element there. What's your vision for how AI fits into the future of nursing?
I think the way we deliver care is going to look very different even in 2 years, let alone 5 years. The technology is coming fast and furious, and I personally believe that we need to own, we meaning nursing and frontline clinicians need to own what that integration looks like. We need to embrace it. And the reality is, right now, we are dealing with a math problem. We have an aging population and we have dwindling resources, meaning our precious human resources. We simply don't have the size and magnitude of workforce that we need, and we can't manufacture more people out of nowhere. So then how do we integrate AI and technology in a way that really allows nursing and advanced practice providers and physicians to really utilize that technology and provide the best comprehensive care experience we can to patients? You know, the concept of a nurse bot replacing nursing, I don't believe that we will ever see anything like that. But that is a fear-driven narrative. And you see those fear-driven narratives when people aren't at the table and when they're not evaluating and when they're not helping make the decisions on how to integrate technology.
And part of that's going to come from policy, from when you've done licensure reform to out of practice advocacy. You continue to influence those policies being made at a national level. What do you see next from what you've been sharing and advancing some of that workforce freedom and some of the shortages that are coming?
Well, I do think, again, we've got workforce shortages facing us for physicians, for advanced practice providers, and nurses. So then in integrating technology and taking some of that repetitive non-value add work off of all three role groups, how do you then elevate the role groups? And is it time that we really look at national licensure and scope of practice? There's likely more that nurses can be doing to augment the care paradigm, as well as leveraging people like me as a nurse practitioner with 20 years experience. What does that look like together in a truly integrated team-based model of care? And I think that's the key. How do we leverage technology and really the value of the team around the care of the patient?
If you ever need, though, like someone to test out the nurse bot or some of those activities, I'm down for it. I always joke, there's a whole group of my friends and I that we didn't have children. And we're like, who's going to take care of us? We're like, robots, nursing robots. And so we're 100% on board for, I don't know, 25 years from now. I'm okay if I have a C3PO caregiver, I think.
It's not going to be 25 years from now. These things are already being tested. So if you look at what's happening in Japan and the UK, they're actually already testing the concept of humanoid robotics in a home care setting because there simply, again, aren't the family members, there isn't the community to care for an aging population. So these concepts are being played out as you and I are speaking. And again, it's not that high level human touch, but it's the basics. It's maintaining safety. It's medication management. It's falls prevention. It's all of those things that can help keep a patient safe and also help the primary care team, the humans in all of this, with information and decision making. So I don't think that home care bot is that far out.
I just want to wait 25 years till I think I need it.
There you go.
Being said, but I love what I've seen. You go to some of the big trade shows, you've even seen like the fake dogs that sit on the laps of dementia patients that help them through, sundown and different types of days that are tougher than others. But all of this comes with clinical and operational integration. How do you balance the daily realities of patient care with the long-term strategic innovation across a billion-dollar system, which for you is common, and I'm curious how others can adapt your thinking to even their rural healthcare setting?
We wear many hats, and I think the key to success is empowering leaders to come together and be open to the possibilities. I've been in healthcare now 24-ish years, and growing up, Everybody had their silo and their role, and this was the way we do things. Fast forward to today, we're creating the way we do things. And we need to be agile, and we need to not be so fixed to the past, and we need to be safe and open to what the future is going to bring. That is what helps us succeed in whatever care setting we're in. But it really means letting go of the old way of doing things. I have a saying, you honor what got you here, but what got you here is not going to get you where you need to go.
Very true. How do you measure it when you think about either metrics or even signals within the organization to know when transformation efforts are truly working? You might have your KPIs and your OKRs, et cetera, but what are the other elements, Terry, that you say, I know it's working because of X?
Again, we do have all the KPIs. We are inundated with information, patient satisfaction, staff satisfaction, outcomes. But at the end of the day, it's the culture of a unit or a clinic when you walk in with the coffee cart. And the basics still hold true. You need to round, you need to talk to people, you need to be present. Are people willing to talk to you? What is that level of engagement? And when people are willing to talk to you and have a conversation and honestly be willing to share all the things that they see are wrong, that to me is success, because that means that we can always iterate and improve. And we've got the engagement of the people who are most meaningful to the work. And those are the people who interact directly with the patients.
I really appreciate that one of your measures of success is that people want to talk to you, that they find you and share ideas because you're going to hear what they're having to say. When you think about the future and as well as advice you would give to others, they read your stories, they see what you're doing. What excites you the most about the future of the clinical workforce in the next few years?
The potential. I think there is so much potential. So scientifically, we're seeing discovery unfold at a pace that we have not realized really in the history of medicine. I think cures are going to come very quickly. So then how do we transition? What I'm most excited about is maybe not caring for people in states of illness, but really helping people be well. And that to me is exciting. I think the other piece of it is seeing how we evolve. There will always be a need for some kind of critical care. There will always be accidents and emergencies and the unforeseen. And how much better will our outcomes be? How much shorter will admissions be? Episodes of care with all of the innovation that's coming. How much better can we take care of people? I think those are the things that excite me. The potential is unlimited. I think the only thing that prevents us from moving forward is our own fear and anxiety.
Yet we've seen societally that I call it the easy button, whether it's doom scrolling through social apps, whether it's I'm going to take a pill or an injection for this, et cetera. And you often see these solutions sandwiched in between like a Pizza Hut commercial and, car insurance or all these different messaging areas that to me, to a degree, get lost. If we can help people with wellness, what do you believe gets them there sooner or thinks about it differently? Because being truly healthy and well, there's not an easy button. You have to exercise, you have to get sleep, you have to have nutritious food, you have to be hydrated and mentally well. What are some of the things that with all the technology making it easier, how we actually still address the harder parts of our lives?
Well, I think we're probably at a transition point culturally, right? Because especially in the United States, we have focused so much on work, and so much of our time and attention focuses on work. And how can technology help us get to more time to exercise, more time to read a book, cook a meal? How does technology help us transition back to a state of wellness and not be so heavily focused on the anxiety of work? And I don't have the answers for all that.
I do use ChatGPT for healthy versions of recipes. Some of the things that my husband and I'd love to do, we're like, how do you make banana bread healthier? How do you make cacio de pepe healthier in your approach to it? And then, how long do I need to exercise? So to your point, if you make technology and being healthy fun, it's a really nice crossroads. What advice, though, would you give to an early career nurse or a clinician who wants to step into system level leadership, yet may find it overwhelming as a place to start?
Never be afraid to raise your hand or use your voice. I think very often we hold back, we wait for the perfect moment, we wait to be tapped. You know what? Everyone has a great idea. And if you open your mouth and you share an idea or a perspective or an opinion and it doesn't land well, it's okay. Don't be afraid to fail. I've had plenty of failure in my life. We focus on all of the wonderful successes, but for every success, there's at least two failures. And I think, when you're early in your career, those things can be devastating and they can prevent you from moving forward. Failure's okay. We learn from it and we move on. And I think the truly successful early career people are going to be okay with that. And they're going to know that there are people like me behind them that are going to encourage the failure and be willing to dust them off and help them move to the next thing.
When you shared earlier in the conversation about empathy and empowerment, that goes right along with when they do fail, making sure that you have empathy and empower them to try again. Such a powerful combination. To your point, when you're in your 20s, it's devastating to make mistakes unless people tell you that it's okay to do that and show a path forward and share your own failures. That's one of the things I love to do with younger generations is like, here's all the things I messed up. You might still mess them up too, but at least you know what I did. And they go, oh, wow, you really did that? Yeah, I really did that.
Yeah.
So it's good to hear it from others. Anything else that you believe is important for those listening to our conversation to know about the amazing work you're doing at Duke and some of the life journeys that have gotten you there?
Well, I think, I've been extraordinarily fortunate. I've never met an open door that I wasn't willing to walk through, but that's because I was encouraged and I had lots of incredibly supportive family and friends and colleagues along the way. And I can't underestimate the amount of potential that is there in the people that are joining our workforce is incredibly exciting. And I want to see those people realize their potential. I mean, everybody, kind of guffaws at Gen Z and Gen Alpha and all that. These are people that have incredible ideas and incredible potential. And I'm looking forward to supporting them to their next level.
Yeah, same. It's fun to work with 20 somethings today because
Yeah.
they try to keep me cool, but I also am able to help bridge some of these gaps more effectively for others. No conversation is complete without some speed round. Are you ready?
Sure.
All right. Along the theme of being healthy, coffee or tea to start your day?
Coffee.
Agree. Couldn't agree more. What do you believe, Terry, is the one piece of technology that is overhyped? And then which one is underappreciated?
Overhyped, I think, right now is wearables. And underappreciated, I don't know if you can call this technology, but whiteboards, good old-fashioned whiteboards. So underappreciated.
All of This Week Health have them in our home offices. And we're like, oh, it's right behind us on the whiteboard. And people are like, what do you guys still have those for? I'm like, I love a dry erase marker. Right. There's really good ideas that don't go away. That and sticky notes. It's funny you mentioned, though, the wearable piece. I stopped wearing my Apple Watch recently. It's the third one I've had. It doesn't hold a charge anymore. And I'm more frustrated by having to plug it in all the time. So I'm like, I have really good habits. I don't know that I need my wearable to constantly be reminding me. It was fun for like 7 years, and now it's not that fun anymore.
Yep.
All right. Last question. If you were not in healthcare, what career would you have pursued?
Well, I had a few careers before healthcare,
You had some really cool ones, actually.
probably either education or law.
Would you ever think about combining them? Like, there seems like there's so
Sure.
much space for all of the above, and you're basically doing that today. You're influencing policy and you're educating all these generations on the amazing innovation in nursing. So you're kind of already doing it, which I love.
Without the degree.
Hey, without a degree in the other ones. I think it's sort of like just, how we practice things that we have a passion for.
Right.
Terry, thank you so much for sharing your insights, energy, and vision with us today. Your ability to blend clinical depth with strategic foresight is exactly what healthcare needs in this moment of transformation. Terry, thank you for being on the show.
Such a pleasure, Sarah. Thank you for having me. Thanks
for listening to this week's keynote. If you found value, share it with a peer. It's a great chance to discuss and, in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we'd appreciate it. Thanks for listening. That's all for now.